Hey, good morning, everyone, and welcome to the Medicaid Monthly Virtual Meeting. I'm Beth Fisher. I'm a staff assistant in the Commissioner's Office, and I help to lead the department's communications efforts. I've probably communicated with several of you on this
Muted
meeting.
for me.
Um, and I just want to ask everybody to please mute your microphones if you're not presenting. We do get a little bit of background noise if you're not muted, so thank you. Unfortunately, the Senior Deputy Commissioner, Veronica Judy Cecil, cannot be with us today. I'm stepping in to share some of the information Veronica had planned to share, and we're going to have some other team members also step in to present. So bear with me. As I said last month, I'm certainly no substitute for Veronica, but I will do the best I can. So let's take a look at today's agenda. We are going to talk about a town hall meeting the cabinet is planning for next week that we're very excited about. The Team Medicaid will have a presence there and are very excited. Helen Dawson is going to give the renewals and eligibility update for the department. We'll talk a little bit about the Anthem transition. And Angela Sparrow from our behavioral health team is going to give an update on Medicaid's reentry program. And we have a special guest from long-term services and supports. Actually, I'm sorry, we have a special guest from Dale. We have our team from long-term services and supports on the meeting to give the waiver update, and they have an exciting update about their team that we're happy to share. Then we'll move to the guest spotlight from Dale, and they're going to talk about the PACE program. We have the wonderful Phyllis Sosa with us today to talk about PACE, which is a wonderful program, and we're excited to share information about that. And then we will kick it over to Dr. Judy Terrio, the department's medical director, who is going to give the update for the Our Healthy Kentucky Home campaign. And she's going to talk about cancer prevention, which is the focus of the campaign for the month of March. Okay, so let's get started. Okay, the first thing on the agenda is the family's first town hall, which is happening next week in Frankfort on March 26th. It is going to start at 9 a.m. It will last about 2 hours. We hope to wrap up by 11. We will have representatives from throughout the cabinet, including Medicaid, but also our sister agencies, including the Department for Community-Based Services, the Department for Public Health, I think is going to be there. The Friskies, the Family Youth Resource Centers are going to be there, and they're going to be sharing information about a cabinet-wide initiative focused on strengthening the system of care for children's health, particularly children with complex health needs. It's a very exciting initiative, and we're very excited about it at the cabinet. So we're hosting this town, and again, we're not launching this initiative at this time, but we are bringing people together to share the vision for Families First, and to also give the public an opportunity to connect with us and to let their voices be heard as well. So if you haven't registered for the town hall yet, I hope you have, but if you haven't, you can scan this QR code on the slide and it will take you to the registration page. If you want to register, I encourage you to do so today because it is filling up. We have space for 300 people and we're getting close to that number. So please, if you are interested in registering, you will probably want to do that today. Okay, and next I will kick it over to Helen Dawson for the update on renewals and eligibility.
Well, thank you so much, Beth, and thank you everyone for being with us today. My name is Helen Dawson, and I'm with Altara, but we've been partnering with DMS for almost 3 years now to prepare for and then go through this unwinding and continue on making sure that renewals are going smoothly for Kentuckians. So what you're seeing now on the screen is just the most current look at Medicaid enrollment. We want to make sure we share this update regularly, but I can speak to a little bit that you're seeing on the graph. So when the PHE ended and renewals had to resume as part of that ending and the unwinding, we anticipated this decline. So you see that starting in April of 2023 and May 2023. However, for a while now, we have been hovering right around 1.45 million and holding steady pretty close there. As soon as those all those PHE renewals really wrapped up, once they got to that final month of all the cases being processed that you see happening around June, July, and August, we're right about holding steady ever since then, which is great news. It's it was, expected, and we're happy to see that what we anticipated was in the data this way, and that we're keeping that enrollment close to the same level. On the next slide, um, just, when the PHE unwound, we had to move back to normal eligibility and enrollment practices for renewals. This includes the typical annual renewals for all members. So we resumed renewals in April 2024, but those have, we've completed all of the renewals for members that hadn't been through one during the public health emergency, or some of them never had because they enrolled during the public health emergency. So all of those sort of PHE related renewals have been conducted, and we're right back into our annual cycle of renewals and assessing for eligibility and enrollment the way is typical. We do have a few of the flexibilities that are still in place in June. The flexibilities were strategies or policies that Kentucky was able to implement during the PHE unwinding to make those renewals processes a little bit smoother, to help members stay covered, help members have additional time to respond to their renewal notices and get the information in they need. And these will continue through June 2025. This includes continuous child coverage. We're currently automatically renewing children, granting them 12 months of continuous coverage, and that will continue on through June 2025. But starting in July 2025, renewals for children will resume as well. We're working on some communications that we can get into the hands of providers, schools, connectors, community organizations that will help share that information with families and households so they know what to do when their child's renewal comes up to try to avoid any loss in coverage. There was also an update from the CMS last year that allowed the state to make some of the flexibilities permanent. And so Kentucky is considering those and working on how to make some of those flexibilities that were allowed during the unwinding permanent in our policies. Also, this work is tied to the final rule on eligibility and enrollment requirements. And so the state is making sure, or DMS is making sure that we'll be in compliance with all of those requirements too as they move forward. We have continued monthly reporting and updated reports to CMS where we report renewals each month. And then after 90 days, we report an update on those cases, showing how any cases that were pending were processed within that 90 days. So let's dive into that on the next slide. You can see the reports at a pretty high level here. All of these reports are available on the PHE website, so you can always go look at them further. But what you're seeing here is the original numbers from the report submitted the month following that month. So on the 8th of the month following that renewal reporting period. That's a little confusing, but I'll speak to it in a second. And then on the right, you'll see the updated cases. So after 90 days of the processing period, where did those cases kind of land? So if you look here at November, we reported on the 8th of December that there were 30,194 approvals in November renewals, 1,334 terminations, and 5 that were still pending process completion. You will notice that this does not add up to the 38 because we were extending members using those flexibilities I mentioned before to give more time to members to respond. So you'll see that in the report online, but you won't see it on this table just because it's getting a little busy. But you will note that on March 15th, we submitted an updated pending cases report to CMS. Now, what that means is that after 90 days, which is the reconsideration period, where if a member comes back and provides the information that we had requested, they can be reinstated back to their termination date. So there were shifts in the numbers there, as you can see, but also in the cases that were processed. So at that 90-day point, all of those 5 cases had been processed, and based on the numbers, you can see they were all processed as approvals. So the coverage continued. Then let's go ahead and look at the next slide because we do have a little bit of a different snapshot for those most current months. So these are the months that are within their 90-day reconsideration window. So we haven't submitted an updated pending cases report. We track them a little differently because of that, and sort of just the fact that they're a little bit still ongoing because of that flexibility. So the numbers aren't as concrete as some of the others. These report highlights members that are approved, terminated, those that were pending at the end of the month, and then those that were extended as part of the flexibilities that I mentioned before. So you can see those numbers on the right-hand side. Again, these are, oh, excuse me, I think on the left-hand side, you can see that table. These are up on the website. So I encourage you to check those out if you want more details, more of a breakdown, some additional notes that are in there. This is just a snapshot. But then you can see on the right-hand side that we are tracking the reinstatement. So people that come back and get reinstated for their coverage. So things are changing every day as members come back. And so we're just giving updates that, those are the reinstatements that we've seen as of 3/14/2025. All right, so on the next slide, we just want to continue to remind people about what is available on the website. I've mentioned those reports, but there's a lot of information on there as well still. There's flyers that you can use, for helping members navigate the renewal process, specific things like ID proofing, and there's, materials that you can use as flyers or in your offices if you're a provider or a community-based organization or anyone that might, benefit from sharing this message, or have members that are, could benefit from reading it if they're walking through. So you can always feel free to take these. We keep them updated. We're working on, as I mentioned, some of those child renewals and some communication materials. So we'll make those available soon too. And then on this next slide, I think this is the last one for me, just giving you a snapshot of what the website looks like. This is where you find those reports, those communication materials, and a bunch of other information that might be really useful. So I encourage you to go to medicaidunwinding.ky.gov if you're interested in checking out a few of those. So thank you, Beth. I can turn it back to you.
Thank you so much, Helen. Okay, so the next portion of the agenda is the Anthem Medicaid transition. For those of you who aren't aware, Anthem Medicaid Managed Care is no longer a part of Kentucky Medicaid as of January 1, 2025. And this process involved moving those Medicaid members enrolled with Anthem into a new MCO. And we did that automatically, but members were also given the option to change their MCO if they chose to. That process is now complete, went very smoothly. Providers can still file claims with the departments, and this slide actually has some information on who to contact or where to go for information about that, or if you have any questions as a provider, or if you're a Medicaid member who has experienced any difficulty with this Anthem transition, or just have any questions, you are welcome to contact us. There is a hotline number you can call, and we also have a website as well that I will try to drop in the chat in just a minute. That is really the only update I have regarding the Anthem transition, so we can move right along to the next agenda item, which is the reentry update.
Good morning. I was trying to rush us along. Good morning. It was slated as Angela Sparrow, but I think there was just a mix-up in the invitation. For some reason, my name popped up as Angela Sparrow, and I had to change it. So sorry about that confusion, Beth. But all right. So I'm sorry, I'm Kristen Schroyer. I'm one of the behavioral health specialists in the Department of Medicaid. Reentry is one of the projects we're currently on. You want to go ahead into that next slide? So this is what we call our Team Kentucky 1115. We had official approval on December 12th for the following components. So we have our SUD, our reentry, health-related social needs, SMI, and then under that will be also recovery. So these are all the things, all the components that are part of this overarching Team Kentucky 1115. Can you go to the next slide? So as most recently, March, we submitted our Team Kentucky SMI, which is serious mental illness, and our HRSN. Excuse me, I've been under the weather. Deliverables were submitted to CMS. That is currently where they're sitting, and we are waiting for their feedback. We are currently conducting interviews with our local jails to continue on with our CAA, which was the Consolidated Appropriations Act, which is for our youth. and into the reentry. So we are just working towards a continued go live for the fall. For the reentry part of the program, we've started, like I said, the interviews with the jails on CAA to help extend that. As you can see in the timeline, we have a phase 2, we have a phase 3, and that is just as we get everybody onboarded and up and moving. There's just a lot of components that are in place there or that have to be put in place. So we're continuing to work on requirements for our IT systems to support reentry. We're having reentry specific work groups, and we're just continuing to work on the deliverables due to CMS for this whole overarching Team Kentucky. So multiple facets to address, and we are not stopping with each step. As one step goes, we are already working and planning and going into the next step, and we just hope to stick to our timeline as close to possible with that fall reentry go live. And I think that's all I've got, Beth.
Thank you, Kristen.
Good morning. My name is Alicia Clark, and I am the Assistant Director of Long-Term Services and Supports. And I will be giving the waiver update today, and also introducing a new person to our team that we are excited to have. And so we want to welcome Carmen Hancock aboard. She's on the call today, and I'm going to just let her give her introduction to you all and give a little bit of just information about herself and her experience, and then she'll turn it back over to me, and I'll go over our slides for the rest of our part. Carmen?
Yes, thank you, Alicia, and good morning, everyone. So my name is Carmen Hancock. I'm coming with experience that starts back in the CMHC world at Communicare, where I started as a support broker and worked up to Chief Disabilities Officer, overseeing all of the waiver and intellectual and developmental disability services for the Communicare region. So that includes all Michelle P. waiver, SCL, SCL2, ABI long-term care. I worked with MFP transitions, as well as other things like heart-supported living, state general funds, and overseeing the physical intermediary portion of PDS services at Communicare. I'm looking at my slide here. So I recently served as the executive director at Recovery Works here in Elizabethtown, which is a substance use treatment and recovery campus. And prior to that, I was heavily involved with social determinants of health programming in affordable housing communities in Texas, where I was heavily embedded in projects with managed care organizations, working towards quality of life and health outcomes. I've wanted to have a role like this for quite some time. I'm really excited to be here. And at this point, I'm just kind of sitting in and observing. I'm on day 4. So give me some grace, and I will hand it back over to Alicia.
Thank you so much, Carmen. Do you want to go to the next slide, please? Thank you. So a lot of this is probably information that you all have heard again before, but just to kind of recap some things. First, our home and community based and our Model 2 waiver renewals are coming up, and they are actually out there right now for public comment. So please, if you have not looked at those, you all are interested, public comment is open until April the 13th at 11:59. If you have, if you need to know where to look for those, all the information is on our website. So not only are the applications, the summaries of the changes, and it also includes instructions on how to make public comment to us. The next thing we'll talk about is the waiver slots. So as we have discussed prior, all the waiver slots for last fiscal year or were already awarded and given out. But starting 7/1 of 25, we will have additional slots. So as you can see on the screen, for acquired brain injury, long-term care, we will have an additional 25. Our home and community-based and our Michelle P. waiver will have 500 additional slots. And the SEL, or Supports for Community Living waiver, will have 250. We are working still through that plan. We do understand, if we was to release all of these at once, that would create a bottleneck, right? Because everybody has to get assessments, and the assessment teams are based on waiver. So we are trying to come up with a plan. We are working with our sister agencies, the operating agencies, for that, and hopefully we'll have that done here soon. To go to the electronic visit verification, like we said previously, the Therap system did go live January the 1st of 2025. And if you were using NetSmart and are coming over to Therap, then all of your stuff, you need to archive that before April the 1st. So I know that some individuals, providers, use a third party, and that's okay. But if you were using NetSmart and you were transition, or even you did transition to Therap, make sure you go and archive all of your data. And then the last thing that I'll share today really is about our waiver rates. Those did go into effect on January the 1st of this year. The rates were updated in the current regulations. Now, just one thing to note there, in those regulations we put out, we did not make a lot of other changes, right? It was really just based on the rates so that we could get those through, the entire process. But we do, and we're working on additional regulations for all of our waivers. And those, will come out for public comment when they're ready and all of that. But for the waiver rates, those regulations are out for public comment until March the 24th. So if you haven't made, any comments on those and you want to, please do that. It looks like you've got 4 days left on that. And if you'll go to our next slide. And here's just the information that I share every time. The contacts for each operating agency. As you know, acquired brain injury, acute and long-term care in our model waiver 2, that within Medicaid, we are the operating agency. But for our home and community-based programs and all participant directed services, the Department for Aging and Independent Living is the operating agency. So their information is there, along with the Department for Behavioral Health, as they are the operating agency for the Michelle P. and Supports for Community Living. And then, just a last little plug, if you are ever having any technical issues with the system, we do have the Medicaid waiver management application, the technical support number and email address there. So thank you all for letting me share the updates today, and I will turn it over to our next speaker. And I think that's going to be Phyllis from the Department for Aging and Independent Living.
Yes, hello. Thank you. Good morning, everybody. I don't know how many of you all are familiar with PACE, which is the Program of All-Inclusive Care for the Elderly. And it is a Medicaid program, and they contract with the Department for Aging and Independent Living to administer the program. You can go to the next slide. I already talked about this. So we, in partnership, the department and Medicaid, work together to develop the program, and then Aging and Independent Living, we do the administration, monitoring, and oversight of the provider organizations across the state. The Program of All-Inclusive Care is a fully capitated program. So what that means is that any individual who is enrolled in PACE, the provider organization is paid a per participant rate monthly for that individual. You can move on through these slides pretty quickly, probably. In order to be eligible to enroll in the PACE program, an individual has to be age 55 or older. They have to meet the nursing facility level of care, which is the same level of care vetting as on a waiver program. They have to be able to live safely in the community at the time of enrollment, and they have to live in an area covered by the PACE organization. One thing that's not on this slide is that the individual also has to have either Medicaid, Medicare, or able to private pay for the services. Participants in the state of Kentucky currently on average are 75 years of age or older. They have significant health and long-term care needs. Individuals in PACE are usually very frail. They need a lot of services and supports to help them stay at home. Many of the individuals have cognitive impairments such as dementia and Alzheimer's. They have functional impairments. They need assistance with their activities of daily living and their instrumental activities of daily living. They have significant health needs. Individuals don't usually have just one chronic condition. They usually have multiple conditions that the PACE program is assisting them in helping them be healthier. And that's what we have seen since PACE began almost 3 years ago now. The individuals that have enrolled in PACE have become healthier. They have become able to better manage their disease through the help of the PACE organizations. Benefits of PACE is it's a simple process for the individuals that are enrolled because they only have one provider that they have to call upon for assistance. So that PACE organization provides all the care that that individual needs, whether it's the physician, nursing, any therapies that are needed, pharmacy, medications, even specialty benefits, healthcare. If you need a cardiologist, a pulmonologist, a hematologist, it doesn't matter. Whatever your care need is, the PACE provider organization is going to coordinate and make that recommendation, that referral, set up those appointments, do the transportation to those appointments, and coordinate all of that care. That also includes if you need to go to the hospital to be admitted or to the ER, the PACE organization is responsible for that. They ensure that you get that care that you need, and they follow you through your hospital stay to make sure that they are continuing to coordinate the care and the services. And if there comes a time that you end up needing to be in long-term care, whether it's for rehab services or for a long-term stay in a nursing facility, the PACE organization continues to be your primary care provider. They continue to coordinate all of your services. And they can even, if you're in a long-term care facility, they can still come pick you up and bring you to the PACE center so that you can continue to visit with your friends that you have met through that center or that organization. So they follow you for life until you decide to voluntarily disenroll, or if something happens that they have to involuntarily disenroll you, which is a very rare thing, and that has to be approved by the state. It allows for you to remain in your own home, for you to be involved in your community, to allow your family to be your family instead of your care providers. And it gives you the freedom of choice that you can come to the center to receive your services. You can go to the hospital to receive your services in coordination through the PACE Center, or the PACE Center also provides in-home services. So you can get your care in your home. They come to your home, provide home care. They help you with all of your needs. They also come in and do home health to assist you with the healthcare in the home. And we all know that being in your own home helps to preserve your quality of life and helps your family to be able to be there to help support you as a family member, rather than all of the pressures of being the caregiver and the support services. PACE is based on an interdisciplinary team, and that team includes the individual, the participant in PACE, And there are at least 11 members of that interdisciplinary team that develop the plan of care, to coordinate the services, to ensure that when a participant asks for a service or an accommodation, the IDT is the entity that reviews all of those requests and approves those requests. Or if they have a good reason, they can deny a request. So like if an individual is in a wheelchair and they decide that they want to have a power chair instead of the manual wheelchair, the interdisciplinary team will review that request. And so, for example, if the occupational therapist or the physical therapist does the assessment and they say, you know, this individual, if they get a power chair, it's going to be detrimental to their health because they're going to lose muscle mass. They're going to lose their ability to have strength and conditioning. Then the IDT could deny that power chair, but because it's based on not being in the best interest of the individual. So all of these 11 members talk about the care plans and the needs of every individual every morning and throughout the day often. The individuals go to the centers, the medical team, the support teams, the nutritionists, the therapist, recreational therapist, physical therapist are laying eyes on the individuals almost daily, depending on how often the individual goes into the center, but almost daily, 2-3 times a week. They're going into the home, they're seeing the individuals there. So they keep a really close eye on the individual. That helps them to know, hey, something's not quite right with this person. Maybe we need to get them to the doctor to have an assessment done to see what's going on, to make sure that they are doing well. And the doctors are on site at the clinic, at the center every day. So they have immediate access to that medical care and the attention that they need. You can go on to the next. They also use contracted providers. Currently in Kentucky, most of the PACE provider organizations, because they don't have a huge enrollment at this point in time, are doing the services themselves. So the home care, the home health, the pharmacy, all of that is done by the PACE organization themselves. They do contract with the specialty providers, so like your cardiologist, your if they needed a neurologist, whatever the case may be, those specialty healthcare, they do contract with those individuals. If they already have a provider that they use before they come into the PACE program and they want to keep their current provider, they can have those discussions with the PACE organization, because the PACE organization may be able to enter into a contract with their current provider so that they can keep that provider as well. So they do try to make it very person-centered to ensure that that individual is comfortable with the services they receive and that they are getting that care that they need. So the costs through PACE are reimbursed through, I talked about this a little bit at the beginning, through Medicaid, through Medicare, and through private pay. So an individual who has Medicare only, they don't have Medicaid, Medicare will pay its portion of the cost, and then the individual would have a cost associated with helping to offset the cost that Medicaid would have traditionally paid for that individual. The PACE organizations are who you would need to talk to find out what that actual cost would be to you. The same for private pay. If you don't have Medicaid or Medicare, and you would have to private pay, the PACE organization is who would tell you what that actual cost would be per month to participate in PACE. And if you have Medicaid, there is no cost at all to the individual that is enrolled in PACE. Currently in Kentucky, we have 9 PACE providers that are covering 54 counties, and there are 13 PACE centers. Kentucky is working really hard to try to increase the coverage. These 9 PACE providers have more counties that they are assigned to their service region. They just haven't begun operation in those additional counties yet. It is the goal of the governor and of the cabinet to have all 120 counties covered by PACE, because this is a great program. It provides care where care has never been before. So in areas of the state where there has been little health coverage, very difficult to get into doctors and specialists, we have PACE organizations that are operational, and people are able to see a doctor regularly. They're able to get those specialty services, and it has been a great advantage for those individuals in this program. So it is our goal to have all 120 counties covered, and we are moving toward that. And it has rapidly expanded in the last year. And go to the next. This is the coverage map. The areas that are in the light green are the service areas that have a provider assigned to them, but they haven't yet started the services. So you can see that there's a wide number of counties that already are assigned. They just aren't yet operational. The counties that are in red do not have a current provider assigned to them. And we are in negotiations with the operating providers to get them to see the feasibility to cover those counties. And it is our hope that we will get there, because it would be really easy, for example, the provider in Jefferson County, or that covers that, I don't know what that color is, but up there in Gallatin, Carroll, Boone, that provider to move into the Henry, Trimble, and Oldham counties. It would be pretty easy for the provider that's in the Shelby County to take on Spencer County. So those are the kinds of negotiations that we're in order to get full coverage for the PACE program across the state. People that are enrolled in PACE, I can't tell you how many times I've heard it, that this program has saved my life. They are thrilled to have a program such as PACE to help them. Going into the day centers, they have met friends, they have socialization. A lot of these people had been pretty isolated because they had no transportation, they had no way of going anywhere. They would see family once in a while. They talk about how the majority of their friends have already passed away. So they were pretty isolated, but because PACE provides that transportation, they bring you to the center, they take you home, they take you to scheduled appointments, and they wait with you and they take you home. They are very involved in helping you get the services that you need, and making sure that you can get there. So they all talk about how wonderful the staff is, how wonderful the program is. And in our view, and when I say our, I mean the Department for Aging and Independent Living, there's 3 of us that work on this program, and we just completed our very first PACE audit of a provider organization. And the day that we were on site, the center was full. I mean, they couldn't have fit another person in that day center, and they were all interacting and happy, and you could tell that they just really enjoyed being there and having someplace to go and be a part of somebody's life. So it's been a tremendous success at this point for Kentucky. So these are the PACE resources. If you want more information on PACE, if you know somebody that is interested in being enrolled in PACE, you can go to the website, our PACE website, CHFS Dale PACE. It's also on the DMS website, and get more information about PACE. On that website, we give you information on what counties are covered, what provider organization covers those counties, their contact information, so that you will know exactly who to reach out to, because they do have to come out and they have to do an assessment to make sure you meet the level of care. And I can tell you that it's not just individuals that are currently living in the community. We are having, as of April 1st, our very first person that has been living in a long-term care facility and through Kentucky transitions is getting to move back into the community, into their own home. And they are coming out with the supports and services of PACE. So as long as you can demonstrate that you can live safely at home at the time you're enrolled, you can qualify for PACE as long as you meet the other eligibility requirements. You can go on to the next one.
Phyllis, there was actually a question in the chat.
Okay.
Do PACE participants have to live in the county that the PACE facility is located? For instance, if an individual needs PACE and lives in Leslie County, is that resident allowed to enroll in a neighboring county that has an active PACE program?
Yes, you have to live in the county that the PACE organization covers. However, Leslie County, right now, it does not have a provider, but in the near future, they will have. We are hoping that the PACE provider in that area will be starting the process. It's a very long process, which is why it takes a while for all of the counties to get covered. So it's a CMS program. So the Centers for Medicaid and Medicare have a application period. So a PACE organization can only apply at certain time of the year to become a PACE organization. And on average, once they have filed that application, they then have to get approvals through the state as well. They have to find, where their site's going to be. They have to do all the vetting of the property. And we do what's called a state readiness review to ensure that the buildings and everything are meet our requirements. And it's nearly a 2.5 to 3 year process from start to finish to get a PACE center up and running. So that's the unfortunate part of it, is it does take a while. But we do have the Leslie County area. The provider is selected. They have been awarded the counties, and we are hoping that they are going to be filing an application within the next 12 months for that center. Because one of the other caveats is that you can only, for CMS, is you can only open 2 centers at one time, and then you can't apply for another center until after you have met all the requirements of their first annual audit. So that provider has not yet had their first annual audit. So until that happens, they cannot submit the application for the next center to be built. And then we do have a dedicated PACE phone number and a dedicated PACE email. So you can always reach out via phone or email for any additional questions you have. That phone line is answered by myself, Donna Skaggs, who is a Medicaid Specialist 3 within our department, and Michelle Zimmerman, who is our nurse consultant. And then the 3 of us also answer the emails that go to that PACE mailbox. So, was there another question that came through? I think I saw something pop up.
Is there any way to know what point a certain county is in the process?
You can call us on our line or send us an email, and we may be able to assist you with knowing where a county is within the process. For the most part, that would be hard to know unless we know that the PACE organization has already found their building and are in the process of building that out either through renovation or building it up from the ground up. And if we have done a state readiness review or not. So we would know if an application has been filed with CMS or if, they have, how far down the line they are. But if they are not operational, we cannot tell you who has the awarded areas, because until they become operational, it can be stopped at any time. So that's the reason we're not putting on there who has been awarded what counties. Any other questions? Okay.
Hello, everybody. I'm Judy Terrio. I'm the medical director for Kentucky Medicaid, and I wanted to talk a little bit about the month of March's thing this month. The month of March is Cancer Prevention Month. And so we're going to talk about some ways that you can help prevent cancer and protect yourself from cancer. Actually, some things I think we all do already. First, you want to be smoke-free, and that includes any type of nicotine products, so smoking, vaping, chewing tobacco. If you limit that in your lives, get rid of it in your life, then you are doing a really good job of helping prevent cancer. The other thing, and I don't think a lot of people know this, is eating, whole grains, fruits, vegetables, beans, nuts, just a healthy diet. And people that eat healthy diets, less sugary foods, less processed foods, they actually have they lower the risk of developing cancer also. So I have this wonderful picture of a heart with all these healthy foods. And I picked this picture because if you see nestled in there between the strawberries and the tomatoes, you have dark chocolate. So of course you have to limit it, but dark chocolate is considered a healthy food as well. So it's not just, radishes and nuts. The other thing is eating less red meat, more fish and healthier meats, and limiting processed meats such as cold cuts, salamis, things like that. If you limit alcohol, that will decrease your risk of cancer. And of course, if you do all of that, you're going to be at a healthy weight, and that also decreases your risk of cancer. One thing that I think people think about nowadays is sunscreen and protecting yourself from the sun. Using sunscreen and not going to a tanning bed are the two pretty effective things that you can do to avoid skin cancer. And I want to do a shout out to all of those guys out there that really don't have much hair up top. If you're bald or balding, or if you just shave your head, this becomes a solar device. It draws the sun in. Lots of older men have skin cancer on the tops of their heads. Sometimes it goes without being noticed because that's just not a place that you look very often. And so if you're a man, please use sunscreen up there if you don't have much hair, or a hat. And if you love somebody that doesn't have much hair up there, maybe a hat would be a good thing to do for Father's Day, so you can protect them from cancer. Being active, exercising regularly is another good way to help avoid getting cancer. And then we have our screening test and our vaccines. So next slide. We're actually really lucky that we have 2 vaccines that are made to protect you against cancer. The first one is the hepatitis B vaccine that protects you from getting a liver cancer. And that is administered usually when the baby is born. They get their first shot, and then they get the next couple of shots in the first year of life. The other vaccine is the human papillomavirus vaccine. We call that the HPV vaccine. And that one protects you against cervical cancer, penile cancer, throat cancer, and it's very effective. So if we can start it as early as 9 years of age, but usually we recommend it at 11. If you start at 11, you only need 2 shots 6 months apart. If you start it at over 15, then you'll need 3 shots to get the same protection. But that's a great one and it's very effective to protect yourself against cervical cancer and throat cancer. And then after the vaccines, we have our screening tests for cancer. Next slide. So why do we even screen for cancer with these tests? Well, if you catch a cancer very early, that's much easier to treat. Or sometimes you can catch abnormal cells before they become cancer and treat that, and then you've avoided the cancer altogether. But there are several screening tests that we'll talk about here in a second that really are made to detect cancer early. And then, of course, the earlier you get diagnosed, the earlier you get treated, the better your chance for a cure. So if you're a woman, you need to screen for breast cancer and cervical cancer. If you're a man, you need to screen for prostate cancer. And then everybody needs to screen for colon cancer, lung cancer if you're a smoker, and then skin cancer with that full body skin check. Don't forget the top of your head. Next slide. When do you start this? Well, most of the time you start it as an older adult. The more research they do, they're moving these screening tests to younger ages. So breast cancer, the normal age to start screening is 40 years of age, unless you have family history or some other risk factors where you'll screen earlier. Cervical cancer, you start screening in your 20s and with a pap smear. Colorectal cancer, we used to screen at 50. Now we've moved that down to 45. So we start screening 45 with either the fecal tests or a colonoscopy. Lung cancer, if you smoke, and that's heavy smoking, and you've quit, either you're still smoking or you've quit within the last 15 years, that usually starts around 50, screening for lung cancer, and that is done with a CT scan. So next slide. I do want to mention what was not on those slides was prostate cancer. You start screening between 45 and 50. That's a simple one. That's just the blood test. And of course, skin cancer, you're starting to screen about the same age, 45 and 50, and that's with that full skin exam by a dermatologist usually. And what are the rates of cancer in Kentucky? You know, why should we do this? Well, our rates in Kentucky are a lot higher than the country average rates. For cervical cancer, we're a lot higher. And again, that's one that's prevented by the human papillomavirus or HPV shot. So just increasing those vaccines is gonna, bring that rate down. Colon cancer, we're at 45.9 per 100,000, and nationally, the rate of colon cancer is at 36. So we need to do a little bit better job in the state of screening for colon cancer. Again, you can screen for it, diagnose it, treat it, all with a colonoscopy. If you catch it early, it's not a big deal. Lung cancer, we're not doing good with lung cancer. We're at 84 per 100,000, and nationally, the rate is 53 per 100,000. And again, this is easily detected with a low dose CT scan starting at 50 if you're a heavy smoker or you have heavy smokers in your family. Encourage them to get this test. Melanoma, we're pretty high, but luckily breast cancer and prostate cancer, we're right at the national average. So we're not any higher than other states. But these are simple things you can do to screen and detect the cancer early and get cured, and they're easy for the most part. So March is Cancer Prevention Month. So some of it's in your control because you get to eat healthy and control some of those factors. Others aren't in control, but you can screen with these tests and hopefully avoid cancer or at least detect it earlier. And that's about it. And this is all on your Our Healthy Kentucky Home website. If you go to that, you can have a lot more information about screening for cancer prevention. Any questions? Okay, thank you.
Thank you, Dr. Terrio. Okay, that concludes the agenda. If anybody has any questions, please feel free to share them in the chat, or you can connect with us after the meeting. We love hearing from you. If you have suggestions for, I'll go to the next slide, for topics of interest or agenda items for these meetings, you are welcome to share those with us as well. That really helps direct the content of these meetings. Our goal is to share information with our interested parties and partners, to keep you informed and up to date on things happening within the Department for Medicaid Services. So thank you again to everyone who attended the meeting today. We really appreciate it. We value your partnership and collaboration, and we hope to see you again next month. And we hope to see you next week in person at the Families First Town Hall. So have a good day, everyone.